Hi, everyone. I'm Maren McKellen, Manager of Field and Experiential Learning and Study Abroad. And we in the Global Ed office thought it would be interesting to talk to our faculty to get their perspective on the pandemic and how it relates to their fields of expertise. With me today is Dr. Robert Moorehead, Associate Professor of Sociology. Robert, thank you for joining me today.
Thanks for having me.
I'm again reminded of the importance and benefits of a well-rounded education as I research some of the things we might discuss today. Sociology, as the study of human social relationships and institutions, seems very much at the front and center in understanding the global pandemic, especially as it relates to social causes and consequences. Is that fair?
Mm-hmm. You got it.
Okay, so Robert, I'm interested in hearing some of your thoughts about the global pandemic as it relates to sociology.
Well, I think if we're kind of taking this, a global perspective, but certainly the pandemic is hitting every country. I've been interested in this what to me seems to be a very American reaction to the issues related to the pandemic, and the sort of rather a distinction that's pretty strong in the United States between sort of the individual and the social group. And certainly here in the United States, this high valuing of the individual, each person kind of blazing their own trail, and you can't hold me back, and that sort of very individual focus, as opposed to a more communal social focus. And in my classes, I've tried to get this idea across the students and linking together the work of a few different scholars. Some are in sociology and some are not. And one, Jennifer Wright, a sociologist I was in grad school with, her work, she looks at, why some parents choose to not vaccinate their kids. And what is it? How does that make sense to the parents? How can we understand this logic of parenting that's going on? And she noted that in recent years, we've had this strong focus on very individualist parenting, that it's up to you individually as a parent to map out your kid's future, to take care of your kid. If your kid does well, it's because you did something right. If your kid does something poorly, it's because you did something wrong. If your kid is sick, it's because you did something wrong. And there's no broader public discussion about public health or the social issues. It's your individual responsibility as a parent. And if we see a child with a problem, we wonder, what did that parent do wrong, right? If a child is born with, some birth defect or something, we go, what did that parent do wrong during pregnancy or something? And it's fitting along with this very consumerist approach, I think, to managing our personal health, that your personal health is your personal project. It's up to you individually to keep yourself healthy, to manage your diet, to manage your exercise. You can get the right apps for your phone or for your watch that can count all your steps. And it's this individual consumer thing that you're responsible for in keeping yourself healthy. And so from that, it kind of logically follows that it's your individual consumerist choice to decide whether or not to vaccinate your kids, that you look up the information, you make that individual choice, and then you decide whether or not that your child is going to be vaccinated. And yet, vaccines aren't just for the individual person, right? They're also about protecting the group. And Wright gives the example of an MMR vaccine. The R is for rubella. And that vaccine is really, we give it to children so that pregnant moms don't catch rubella. And so it's that you're vaccinating the person so that, for the benefit of someone else. And similarly, we kind of think that, well, if she expresses the concern that, we're focusing so much on our own individual health and well-being, like, if my kid is healthy, what do I care if some other kid's not? If my kid has fresh drinking water, what do I care that the kids in Flint, Michigan don't? If my kid has a good education, what do I care if some other kids, don't have a good access to a good education? And we need to think not just about from this individual perspective, but also from a much more communal social perspective, that it's easier and actually better for all of us if all of us have access to clean water and have access to a good education, that we can do so much more communally, socially than we can individually. And And so we're thinking about how the pandemic spreads. It's not just about my own individual health and well-being. My health and well-being is dependent upon the health and well-being of the people around me. I can't seal myself off in a vault. I'm never going to go out. I'm going to have all my stuff delivered. But the person delivering your food could be ill. Does that person have access to health care? Does that person have access to paid sick leave if they shouldn't be going into work? And so hopefully this can kind of reinforce this point that, you know, our own individual health is dependent upon a broader communal social health. But that requires a reframing in our thinking, taking us away from just thinking of us as the individual and now thinking like, you know, that health isn't like pie, that there's only so much of it to go around. And if you get some health, then I'm going to get sick. Right. And it doesn't work that way. The pie can be made bigger. And so that, right, it's you know, Andy Zoss, Professor of Sociology I had as an undergrad, has the concept of the inverted quarantine. Long before Jennifer Wright was doing her work, that this, again, a very consumerist approach of putting this kind of bubble around ourselves. Normally we quarantine off the sick and keep them away from the healthy. Yes. And what Zoss is noting is that we're quarantining the healthy to keep them away from the sick. And so my house is this inverted quarantine in which I have filters for my water, I have filters for my air, I have all these things to keep me protected. Meanwhile, you know, the world outside my home can just go to hell. That it's, you know, it's not, it can be all contaminated as long as I'm safe. And while that's great for the companies that sell water filters and air filters, certainly if you can get us to, capitalism is a part of this, you get us to have some kind of fear and then sell us a product to address that fear. Or we could just see that everybody has clean water and, you know, pursue legislation to clean up our air. That we're not really addressing the problem, right? We're just
he calls them imaginary safety bubbles, right?
Yeah, it's an imaginary bubble. During this whole thing of the vaccines and people worried about the virus spreading, I just keep thinking back to the years before we had a polio vaccine. My dad caught polio in 1949, 6 years before the vaccine was developed. And how terrifying that must have been for people. Went on for 6 years before, right? And so people were catching it before he caught it. FDR caught it, right? Long before my father did. And so you have, decades there of people catching it and worrying and not knowing how it's transmitted. And yet we got a vaccine, made it available to everybody for free. I remember my dad being very vigilant, make sure that my siblings and I got the vaccines and their grandkids. You're taking your kids in for the vaccines, right? He would be furious today if these people said, I'm not going to get back. Vaccines are fake. Like, he would just, you know, because how much his life was changed because, you know, they didn't have the vaccine. And you're going to put that on, you're going to put your child at risk for those same illnesses, the illness that, you know, altered the course of his life. That's one of the reasons why he's not with us today, is that the symptoms of polio come back decades later after you first catch the illness. And so it's thinking, this has really been kind of in my mind, is sort of the reaction to vaccinating. I'm not going to vaccinate my kids. I don't need to think about other people, and it's how terrifying that is. You know, I lived in Japan for a number of years, and there it's really common for people to wear a face mask. If it's cold season, flu season, you wear a face mask. And it's both to protect yourself from others, but also to protect others from you. That it works both ways. And so it's really common for people to go to the convenience store. There's just masks everywhere, and people wear them. And I first thought was, my God, all these people are sick. And it's like, maybe some of them, you know, could be feeling a little under the weather, but more of them are like, I'm on a train with a bunch of people. I'm in a crowded space. Japan's a very densely populated country. I'm in a crowded space with all these other people. And so to keep everybody healthy, myself and others, you know, put that mask on, and a sense of responsibility, not just for your own well-being, but for others' well-being. It's kind of a general part of the socialization that I think a Japanese frame of mind. Whereas here, we're much more focused on, you know, me, the individual. And you can't tell me not to wear a mask. How dare you force me to wear a mask when I go into a store? Well, how dare you risk, you know, infecting other people? And so in my mind, as I've been trying to make sense of this and thinking about how to present it in my classes, also been thinking of the work of Tom Nichols. He's been in the press a lot the last few years. His book, The Death of Expertise, how everyone's an expert now, that we don't need to listen to medical experts who've been studying pandemics, viruses for decades. What do they know, right? We don't need to listen to sociologists. What do they know? That it's just the idea that, we get so caught up in studying something that it's just reinforcing our own biases. And everyone can be an expert. All you need is a computer and the internet. Go to Google, go to YouTube, find out what you need to know. And you're just as much of an expert as anybody else. And that makes it, I think that, again, this is sort of that there's a battle between the individual and the communal and the social in that same framework, right? It's like, who are these other people to share information with the public versus me, the individual. I can be an expert at everything. I can learn all about virus transmission. And certainly we've all learned a lot. Terms like social distancing have altered our vocabulary. But when I need information on this, I look online for information shared by doctors. I go to my niece, who's a pediatric pulmonologist, and whatever she shares, okay, it's got that MD stamp of approval. I value her expertise, and if she ever needs a sociologist for something, hopefully she'll come to me. But it's hard to get that information out to people if people become sort of mentally wired to, not biologically, but sort of in your frame of mind, you're thinking, to dismiss that other information. It's all news, or it's all just biased information. And where do you go from there, right?
When I was reading about some of the Tom Nichols, he had a quote that said, "These are dangerous times. Never have so many people had access to so much knowledge and yet been so resistant to learn anything." It's exactly what you were saying.
Yeah, it kind of pointed in my head and it just went out. That we used to think that, with the key to God, imagine if everyone had access to all this information, that these attitudes are driven, we just don't have information. We have all the information in the world and the history of humanity at our fingertips. In that sense, amazing. Think about how the last 20 years have revolutionized the access to information. We're not going to read it. We filter that information through, we have these filters in our mind that process, we hold on to some information, the rest we sort of push away or dismiss. And so I've been focusing on my classes and trying to get students to understand how those filters work. And how
are the filters the same as biases?
Some things and to rejecting others. So I guess the last connection that I made to students this semester was from a recent piece by Ibram Kendi, the historian of race. He had a piece in the Atlantic titled "We're Still Living and Dying in the Slaveholders Republic." And Kendi makes this distinction between the freedom to and the freedom from. We love freedom in this country. I've asked students in class, some particularly American values or ideals, and they're like, freedom. Some freedom to what? Freedom from what? And I get kind of a blank stare. It's this knee-jerk reaction. Freedom. Hand has to go up. But Kendi makes this point of, this slaveholders approach that, that the evil federal government was taking away the individual slaveholders' freedom to enslave other people, while the slave was interested in the freedom from enslavement. That enslaved people knew that their condition of freedom depended upon others. It's because of the group that they belonged to that they were enslaved, and that they needed others in their group. Everyone needs to be free, right? This freedom from enslavement. You can't have the freedom to do anything if you don't have that freedom from those things being taken from you. And so we extrapolate that out to sort of this freedom to not wear a mask, freedom to go out without a mask, freedom to not engage in social distancing, to get up close to people, get right up in somebody's face if you want to, and I have that freedom and they can't take that freedom away from me. But is that the freedom to infect? do you have the freedom to infect me because you don't want to wear a mask? And can I have a freedom from infection? What other freedoms can I have if I've been infected and I'm in the hospital with a ventilator? And so how do we achieve a balancing of the individual freedom to do things and the communal freedom from certain things? And it's that, again, that battle between the individual and the communal or the social. And I think there's plenty of people around the world kind of looking at this American resistance, people marching in the streets with military-grade weapons and, going into the Capitol, the legislature and the Capitol building, and with your military-grade weapons and demanding that you not be forced to wear a mask, and you be able to go out and get in other people's faces. Just shocked, like that. Not this. How healthy is the individual if everyone around them is sick, and not seeing a balance between these two things? And I think that's a particularly American challenge, this American perspective. If you look at a more global sense, that we, not to wrap the whole rest of the planet in kind of one, under one kind of umbrella discussion, but I think in plenty of other societies, that understanding of the relationship between the individual and the bigger social group focuses more on trying to balance the needs of both. And here, those who've been the loudest in opposing restrictions during the pandemic have been ones who focused almost solely on that individual freedom too.
He talks about it as the individual as king.
Yeah.
And damning the community control if it doesn't support my right to inflict harm and affect wellness on a community.
Yeah, it's like well, I guess the price we pay for our individual freedom is that a bunch of people are just going to get sick and die. Kind of like, the gun control issue, right? That the price we pay for the freedom to bear arms, that some school children are going to get shot. And really? Is that the only option? Is that the only world that we can live in? And if we look at, I think, take that more global perspective. You lived in one society and that's the only one that you know. That's going to be how you see the world.
Right.
And so we take that, the importance of global travel and, visiting other places and living in other places, is that you get that whole other perspective. People seeing the world through a totally different set of lenses than the one that you bring. And it kind of gets a bit, that culture shock moment at first, it's disorienting, but it's also reorienting. You're kind of recognizing, hey, why don't we do that? Well, that's, it makes so much sense once you kind of understand it from a different way.
And even you were saying earlier with Jennifer Reich, she phrases it as, there's power in the individual taking care of the community. And I'm trying to think how can we appeal to people that, in terms of some of our best ideas were things that, maybe I don't use the library, but I benefit greatly from having a library in my community, or public education, a fire station, things like that. And, she talks about just the power of the individual having, the power the individual has on its community.
And so we didn't have public fire service. Right? You used to have a little tag outside your house for which fire company insurance thing you were paying into. We're at a community college. And so it's this open access public institution with the idea that we as a benefit from living in a society in which people have, low cost access to high quality higher education. Even if you never go, your fellow workers, the people you work with, your neighbors, the people you might hire in your business are going to be educated and have the skills that they need because we've made this thing available to them. And I think John Green has the point that, he's a writer, he's not an academic, but he's got a bunch of books and podcasts out there, YouTube channels, that, he supports public education, not because necessarily he has kids, but because he doesn't want to live in a society with stupid people. I'm paraphrasing, but we benefit from living in a society in which there's sort of a basic minimum of education that we all that everybody has, that, you know, we have skilled workers, we have roads to drive on that aren't all private, we have clean air and clean water, because we've taken these steps to kind of take care of each other, and we collectively can do more than if we all of us individually tried to do those things. We don't all have, you know, barrels in our backyard to catch our own individual water from the sky, that we collectively create these public systems that benefit each other. And so we need to, I think, rethink that, reappreciate that, those benefits that maybe we've taken for granted, and understand that relationship between the communal and the social a bit more.
Mm-hmm. Well, those are good points. Any other insights sociology can give us about the pandemic before we move on? I know that could be 5 hours of a...
Sign up for my class.
Exactly. You know, like you were talking before, viruses don't spread individually, right?
Right. So, yeah, I think this is, as I was telling students late in the semester in the spring, as we were finishing up face-to-face classes and moving online, that this is kind of sociology's moment, that this virus spread through social interaction. And you understand, you know, epidemiologists need sociology to tell them how it spreads, how people are having contact with each other, that the acceptance or resistance of these different measures, who's going to go to the doctor, who's going to be staying at home, all of these things are kind of dependent upon this bigger social understanding. My wife has handed me a note. Oh, that's okay. We're good. Sorry. She's correcting me on something about John Green, but it's all right. I think she says he has 2 kids, a kindergarten girl and a 3-year-old boy, a 3rd grade boy or some boy in the 3rd grade or something.
I love that you have a fact checker. I'm going to invite her to all of these.
Fact checked me right in the middle of it. How about that?
Well, you can't be an expert on everything, right, Robert?
Yeah,
Didn't you teach us that earlier?
You know, she's an expert on his family because she stalks him. So she's got a little bobblehead doll of him in her office. So
wow.
Yeah. Well, he sells the bobblehead. She didn't make it herself. So.
Good to know.
You know, she's not like, that'd really be stalking. Like, you know, pictures of him from hidden cameras she installed in his house and things like that. No.
Talk about it in front of my face.
Yeah, she's standing right here. So, you know, I'm not, you know, like saying things about her behind her back. I'm saying it right in front of her.
I figured.
Long story. Okay.
Yeah, so I can't just keep myself individually, Robert. You know, I'm part of a society.
I know, crazy, right? I often use Japanese examples as sort of a counterexample in my classes because I've lived in Japan, taught there for a long time. And how I tell students how, like in English, we have one word to refer to yourself as a subject, I. You have the same I in every conversation you have, no matter who you're talking to. And in Japanese, there's many different words for I. And the word you use depends on your relationship to the person you're talking to. Is it someone of higher status, of lower status? Is it your boss? Is it your friend? Is it someone who works underneath you? You know, gender plays a part in it. And all those words translate back to just one word in English, I. And so it's a sense that who you are depends upon your relationship with other people. And that the individual doesn't necessarily exist separate from the group. The word for self, jibun, actually the Chinese characters for it, means sort of the self part, like the self is part of a group. And so the structure, these ideas are baked into the grammar of the language. So that, you know, just the very conceptualization of who you are as an individual. Yes, you're an individual who's also a part of different groups. Mm-hmm. And so I think that we in the United States, kind of this American framing, particularly if you're white, if you're a member of the dominant group, it's easier to kind of not focus on how you're a part of a group. You're just part of yourself, or members of subordinate groups by race or gender or sexuality or religion or some other factor, maybe much more conscious of the ways in which their group membership is shaping their interactions with others. Maybe it's just it's a particularly straight white male perspective that's driving this, I think, because you have the luxury of not having to think about the groups that you belong to. You get to be just you. I'm just me, in a ways that other people don't. You may not be as aware how that doesn't. The world works differently for other people. And I think in looking forward, some scholars have also talked about how the pandemic might cause us to rethink urban design of our cities, our public spaces. And I don't know, we've certainly seen the different waves of American urban development, in previous years. I mean, the epidemics that would spread in hot summer months and beginning of the 20th century, late 19th, early 20th century. And we had, sewage systems and public hygiene systems developing in response to that. So I don't know. I think we see really I'm hoping that it doesn't move us away from more densely populated urban spaces just because of the environmental impact that has. If you don't have to have a car, you don't have to have everybody driving to work. You might feel safe, sealed off in your car and safe from the virus, but you're also polluting the planet as you're driving in. Some research is showing that it's not necessarily the places where the virus is spreading more in the city of Chicago, for example, is not the more densely populated parts of the city. It's in where there's more people per household. And so it's not, the south and west sides have really heavy, higher rates of infection. But that's because you're going to have a household, multi-unit buildings, and a lot of people living in each unit, a higher number of people in each unit. And so you have then someone's going out, going to work and getting sick, and then coming home and living with 6 other people that you're going to be spreading it inside the household. We can see densely populated cities in East Asia, for example, that have pretty low rates of infection. The rates in Japan are pretty low. And so it varies, right? Singapore, Hong Kong have had issues. South Korea had some issues. Japan has played out differently. And, those are all places where people are wearing masks. So I think we still need to understand kind of the particulars of how it transmits and, who's more susceptible, who's less susceptible, and how can we build that into our urban environment without moving back to big open spaces, and everyone's got their big open space and they get in their car and they drive into the city, because then we're just going to have our next global health crisis with climate change.
I agree. Yeah, I was going to ask you about how we design public spaces, but you got into it before I even had to ask. So, okay, we are...
Years ago, that was one of my areas in sociology. I haven't done as much work in more recent years, but that's sort of that urban studies aspect of, the design of public spaces and what kinds of space encourage people to use it. Think of some like big open park areas and plazas that are always busy with people, and they're out at lunch from coming out of their offices and they're filling these spaces, and other spaces that just sit open and empty.
Right.
And so there's been interesting work in sociology and looking at what is it
about
draws
those?
to space and to gather and to use certain kinds of public spaces while other spaces just seem kind of cold and empty. Cold and empty might feel good now in the middle of the pandemic, but it's vibrant public spaces is also about emphasizing the social and the communal.
Right.
As opposed to where's an individual space where I can be away from other people and safe and not at risk. We need a vibrant shared public spaces so that we can reaffirm our ties to each other, I think.
That's a good way to end. I think we're all kind of yearning for that right now. I know I am. Is there anything that you would like to add before we wrap it up?
I'm looking at the screen. I have your email on the screen behind here. I don't think so.
We touched on, I know, I looked at it too. We touched on, yes.
I'm sure after we're done, we're like, oh, and then, that's okay.
Well, then you can come up for a follow-up. Hopefully we won't be in this situation for a while.
After we've cured this thing, or the pandemic's gotten kind of put to the back burner with all the unrest going on. And that's a dangerous thing. Because although they're saying that people gathering out in public, if you've got a mask on, it spreads less in open air spaces than it does in closed spaces. So hopefully I was out at a protest in Boys Town on Sunday. And so pretty much everybody had it was encouraging because there's people all around, and they closed off some of the streets So restaurants could put tables out in the middle of the street. And there were a lot of people out. When I ate in a restaurant the first time, I don't know when, but they had like all the windows open. Like it was right on the corner. And so these big windows right on the other side of the windows, the sidewalk. And so just all this air coming. It's basically the same as sitting outside, which is why they probably were able to let people go inside and eat.
Yeah.
And you can't eat and drink and have a mask on, little straw underneath your mask. It doesn't quite.
That was a good reintroduction into the normal. Well, you know what, we thought about having, future chats about other topics. So maybe you can come back and talk about that then.
Okay.
I really appreciate you taking time to talk with me today and sharing your expertise, Robert.
Okay. I appreciate you asking. And I think even Nisa got her head in the...
I know. I was going to say, yes, your dog is famous now. The other one, it will have to wait till your next one. But
She's up on my class videos a few times too.
Oh,
one time coming up over my shoulder. It was cute.
Thank her for that.
Okay.
So, all right. Thank you very much.
All right. Thank you.
Okay.